and welcome to the latest presentation of the hashtag Truth About TC Seminar Series, Finding the Right Care for Your Needs. I'm Daria Gerald, a patient advocate with ThyCa, the Thyroid Cancer Survivors Association Incorporated, and on behalf of the Light of Life Foundation, the Thyroid Head and Neck Cancer or THANK Foundation, and AZI Incorporated, I am pleased to welcome you today. I must mention, this class is brought to you by AZI, and Dr. Busaidy is receiving a speaking fee from AZI for this program. We are so lucky to be joined by Dr. Naifa Busaidy, an endocrinologist at MD Anderson Cancer Center, who'll be leading today's discussion. Dr. Busaidy, would you like to tell us a little bit about yourself and provide an overview of today's seminar?
Sure. Thank you so much for that kind introduction, Daria, and welcome to the audience. I wish we were all doing this in person, but maybe next time. So as Daria said, I am Naifa Busaidy, and I'm an oncologic endocrinologist at MD Anderson Cancer Center. Basically, I see and treat patients with thyroid cancer, and I do research clinical trials to try and find the cure for thyroid cancer. In my personal life, I have an awesome supportive husband, which I believe is key, and I'm a mother of 4 healthy children, thankfully. I'm a big fan of and feel it's very important that patients understand their healthcare well and are their own healthcare advocates. So hence the reason for this seminar. So our goals for this class are to explain the process of finding healthcare professionals and to provide people living with thyroid cancer as well as their families the information that they need to make informed decisions. So why don't we review the types of doctors and other care providers that may be encountered along the way, what to look for when choosing different specialists, and tips on how to overcome some of the barriers that many face to the care that may arise on a patient's journey. Our core topics are shown here for today's session. They include confirming a diagnosis, seeking a specialist, which healthcare professionals are involved in caring for patients living with thyroid cancer, and general information on finding the right care, some approaches to common challenges to finding the right care, and tips to how to communicate with your doctor, right? So Daria, thank you so much for having me today. And I understand that you have a few items that you'd like to cover before we get started.
Yep, just a few. So thank you. My role is simply to kick off today's session and support Dr. Busaidy throughout the discussion. I'll jump in here and there, maybe pose some questions. If you have any questions during the event, simply post them in the Facebook comments, and we'll do our best to address as many as we can. And we'll also do our best to follow up afterwards and address any items after the event has ended. With that being said, I do need to mention a note about questions and comments throughout this class. Please refrain from discussions about or direct or indirect references to any specific therapies or drugs. Additionally, this presentation is intended for US audiences only. And please remember that this is just for educational purposes. It is not intended, nor should it be interpreted as medical advice or medical instructions, or really to replace your doctor's advice. We advise you to consult with your own medical doctor for all matters concerning your health and your medical care. So, doctor, why don't you walk us through the perspective of maybe someone who's just starting out with their diagnostic journey? You know, maybe they noticed a lump on their neck, or they might have some symptoms like pain when swallowing or difficulty breathing. Whom do you turn to first, and where do you go from there?
Yeah, so great question. So first of all, Daria, I always like to tell patients up front, right, that we need to acknowledge that every patient is different and has their own unique medical history. So the path that each one of you takes depends on your individual circumstances, right? So there isn't one size fits all. But in general, as it happens, most nodules are actually detected by chance during a routine physical examination or a doctor's visit for unrelated reasons. Often it's just a healthcare visit where you had a carotid ultrasound and on the side, coincidentally, they pick up a nodule. So of course, though, if you do notice symptoms, don't hesitate to proactively make an appointment with your family doctor. You don't have to wait till it's picked up coincidentally. So to evaluate the thyroid nodule, once it's found, your doctor will review your medical history, such as childhood radiation exposure, family history of thyroid cancer, or a history of related familial syndromes. From there, your doctor may recommend some common diagnostic tests, such as neck ultrasound, a biopsy, which is also known as a fine needle aspiration. They'll usually order thyroid blood tests, known as thyroid function tests, and some sort of imaging. They may order a CT scan or x-rays. If the nodule is found to be cancerous, one of the first things that the doctor will try to figure out is what type of thyroid cancer, right? Now, in this, the communication is going to be important, right? Your doctor should communicate with you clearly. And if you're not sure along the way, please ask questions. It's very important that you ask if you need more information. The type of thyroid cancer will then determine what type of treatment you need. So most of the time, the most common thyroid cancer is low-risk papillary or follicular thyroid cancer, which in general have very high long-term survival rates. But what the doctor shouldn't tell you is if you had to have any cancer, this is the type of cancer you should have. Make sure that they don't tell you that, or if they do, you correct them. Now, you can work with your primary care doctor as a first good step to discuss and understand your diagnosis. And you may also, however, want to look for a healthcare provider who's up to date on the latest clinical practice guidelines and research literature. That's important too.
So, Dr. Busaidy, we may have a few people here who might not be familiar with the clinical practice guidelines. Can you expand on that a little bit?
Yeah, thank you, Daria, for that question. I think it's important that we understand, even when people, throw these words around like I just did. So clinical practice guidelines can help a healthcare provider give their patients the best possible care. These are usually published by prominent medical associations. Some of these such medical associations will review the available clinical data. They'll consult with various experts in the field and develop sort of like an algorithm or like a roadmap for offering the best possible care. So you can think of these clinical practice guidelines as offering informal guidance and general principles rather than specific formal instructions. And given that new information is always coming in, right, the guidelines get updated from time to time. This is why it's important for healthcare providers to stay up to date. Very often, these guidelines have a patient-friendly version that's available online for free to help people understand their condition. So I encourage patients to go to those. So some examples include the National Comprehensive Cancer Network, or NCCN, can provide patient guidelines in an easy-to-read brochure that you can access on their website, nccn.org, but also the American Thyroid Association has similar. And so it's important to look these up so it helps you when you go prepared to your healthcare provider.
Awesome. Thank you. Those are great resources. So if a person has gone through all these tests and now they've learned what type of thyroid cancer they have, let's talk about, like, where do you typically go from there? And I think one big question is, when should you consider seeking out a specialist?
So in the early years of treatment and follow-up, it's a good idea to at least consult with a specialist. Even if you're going to mainly be working with a primary care provider, that's all you have access to, you should at least get one consultation with a specialist. A specialist can have expertise in dealing with specific situations, such as treating specific types of cancers, thyroid cancer in this case, or even treating pediatric patients, which is a special population by itself, right?
Absolutely. So maybe you could walk us through the various types of healthcare professionals that a person living with thyroid cancer might work with over the course of their journey, and what are all those roles?
Yeah, so this is another area, right, in medicine that gets very confusing for patients. So treating thyroid cancer is often what's called multidisciplinary, right? That involves a team of physicians, especially during the first few years of treatment and follow-up. So typically one of those physicians should be like what I call your quarterback, right? Or the role of team leader, and who helps you navigate which doctors you see and when. So it could start off, sometimes with your primary care provider, but then often you'll likely see an endocrinologist, right? Endocrinologists deal with conditions that are related to hormones and glands. And so they specifically understand the thyroid and thyroid cancer, because that's what they typically manage, are thyroid issues. So, and almost all patients who live with thyroid cancer will see a surgeon to remove the nodule, or at least get their opinion on whether it needs to be removed. Pathologists are a big part of thyroid cancer journey from a medical perspective, but it's not likely that you as a patient would have any direct contact with them. So what they do is they actually play a very essential role. They help identify the cancerous cells, interpret the various tests to see how your condition is progressing. And then nuclear medicine specialists perform imaging studies and administer radioactive iodine therapy. Medical oncologists, you may or may not meet, they treat people with more aggressive or metastatic disease in general. Now, sometimes people will experience complications from their various treatments and may need some clinical specialists unrelated to thyroid cancer, such as a cardiologist, right, or a speech therapist. So some practices and institutions will be able to provide what's called a nurse navigator with the training and expertise to help guide you from screening and diagnosis to treatment and supportive care. And I find that that group of nurse navigators can be very helpful. Now, finally, we should point out that mental well-being is so important, and it plays a big role in your physical health. When people say cancer, right, we call that the C word, it brings up all sorts of strong emotions, and it puts a lot of stress on patients and their caregivers and family. So therefore, one should remember or at least not forget about therapists and social workers. They can be an important part of this extended care team and be very helpful, and patients shouldn't be afraid to seek them out. Whether it's temporary, you know, it could be a temporary need or a more permanent, but you need to seek that out.
Absolutely. So those are a lot of different roles. And for those of you that would like more information about each of those specialists mentioned and the roles that they play in the thyroid cancer journey, all of this was discussed in great detail in our Thyroid Cancer 101 seminar earlier this year. And you can find a link to a recording of that on ThyCa's YouTube page. And also we'll provide the links down in the comments. So, doctor, what are some ways that a person can engage with their care team to make sure that they're receiving the best possible care for their needs?
One of the things that I feel very strongly about, and is one of the most important things in our care, is that what you can do for yourself is become your own advocate. Right? It's important and it's great to have a physician acting as a team leader, but ultimately the responsibility to get the care you need rests with you. Healthcare workers across the board definitely have your best interests at heart. So it's important for you to be honest and open with them, but remember that you can be or are your best advocate, right? So you need to take an active role, ask questions. If you're unclear about anything, get some clarification. And, you know, to try to make the most of the limited time you have with your doctors, maybe write things down ahead of time. Try and think of questions that you may think about, because it's hard when you're there and doctors are rushing sometimes, right? So, but also don't be afraid to pick up the phone and ask questions later.
Mm-hmm. So what types of questions should we be asking?
Yes, very important. And actually, some of my favorite patients always ask me, like, doctor, is there any question I'm not asking? Right? It's a beautiful question. It makes me think every time. So along the way, you'll have a lot of questions, and we'll go into more detail about this later, but some common questions will include, have you treated my type of thyroid cancer before? And will my insurance require a referral for procedure X, Y, or Z? Right? Even something as simple as asking the doctor to just repeat themselves or slow down, right? Or maybe explain it in a different way that I didn't quite understand it, right? It doesn't mean that you're dumb or stupid, and there is definitely no such thing as a stupid question. So, but it's important that the patient understand everything they're going through, and you're understandably nervous. You may also want to ask about FDA-approved treatment options, right? Is this FDA approved? And if at any point you're uncomfortable with taking the lead, it's okay for you to ask for help, right? Take a family member or friend with you, or have them on FaceTime if they can't physically be there, especially in this pandemic. Sometimes you may want to seek a second opinion, and it's your right to do so. I always tell my patients, right, if they ever question, they worry about hurting the doctor's feelings, tell them that it's important that you're comfortable, and that if you need a second opinion for a peace of mind, then by all means, go ahead and get one, right? And if your doctor's resistant to that, it's okay for you to do it anyway, or ask them why they're hesitant or resistant to that. So getting a second opinion is fairly common, and they make up important life decisions, right, that you're trying to make here. So it's perfectly acceptable for you to want to understand what options you have and understand them as best as you can. It puts your mind at ease, and then you can decide who you're going to follow up with, right? So that would be time well spent. In particular, I would consider getting a second opinion if your treatment, listening to what the treatment is, involves a lot of significant side effects, or if the treatment is invasive or lifelong, right? And then usually the physician giving the second opinion will often have access to your medical records, lab work or pathology reports or imaging or notes even, right? But someone at the first doctor's office should be able to help forward that information, or otherwise I always encourage my patients to take copies of their record with them, right? Nowadays, everybody has something like MyChart, right, where they can take the notes with them, or it's your right to have your medical records.
That's awesome. So if you've decided that you should see a specialist, like as a patient, you've made that decision that you should see a specialist, how exactly does one go about it?
So there's not like one single right way to choosing a specialist. It's going to take some homework and some research. So for example, if you're being treated by a community physician and it's somebody you trusted, ask them, right? Should I be seeing a specialist? Do you have anybody that you've worked with before or that you recommend or you'd have your mother see? And your doctor may even have a referral ready for you at the time of diagnosis. You also may find it useful to connect with one of the advocacy groups, right? Anyone that was discussed earlier or other ones, and talk to others in your area who have gone through a similar experience, right? Who did you see? What did you do? There's also a lot of online resources to help you find lists of specialists in your area, such as American Thyroid Association and the Hormone Health Network, which is affiliated with the Endocrine Society. Several of the advocacy groups that are putting this on today are very helpful. And then from there, you can look up various doctors, you can read their reviews, and you can even reach out to them, right, to learn more about them. You can even consider researching centers of excellence, right? Especially if you have a rare disease or a complicated situation or a recurrence, meaning it had come back. So that would mean a research center of excellence would be a medical facility with very high quality care for your type of disease and a good track record for patient outcomes. So usually a center of excellence will be an academic or a teaching hospital, typically connected to a university. Right? So getting care at a center of excellence may not always be possible, right? People live all over in different parts of the world. Depends on where you live. But we'll talk a little bit about geographical challenges in a little bit, Daria.
Okay. I just want to echo what you said about the local support groups. They can be such a great resource, especially with helping with some of those emotional needs that come up, you know, in terms of coping with a cancer diagnosis. And I have found they're a great resource to say, you know, hey, do you know any specialists in the area? And they can help with that. So, Dr. Busaidy, how would you approach finding care if there isn't a good match in your area?
Yeah, and that's tough, and it's very common for a lot of people. So if you cannot find a specialist in your area, don't give up hope, right? You'll still receive the care you need. Some patients choose to travel long distances for their care, or at least for the initial consultation to understand what the plan over the next few years looks like, right? Takes good notes. Others may not be able to travel those long distances. So in some cases, a telephone consultation or a telehealth consultation with an expert may be your best option. More people are offering telehealth consultations. You can ask your physician if they're comfortable consulting with another medical expert over the phone or via the web, so they can talk to an expert and then come back to you. And you can even contact that specialist directly yourself. There may be some instances in which imaging or surgical procedures are required, and those unfortunately cannot be done virtually. But in those cases, you may have to travel. So sometimes it's a matter of saving up for certain things that we can travel that have to be done abroad or far away. So if the expense of travel, however, is a barrier, also don't give up, right? There's always hope. There's always a solution for every problem, as my grandmother used to say. There are programs out there that can be of assistance. So first of all, start with talking to your doctor to see if you can get connected with local social workers, because often they can provide guidance or assistance. And I found social workers to be extremely helpful. So some examples, they may have travel assistance programs, right? So as an example, Angel MedFlight is a service that offers free flights to receive care for eligible people. And their website can help explain some of this in greater detail. Or the Cancer Support Community recently launched an Airbnb service to help eligible people find lodging when they travel for care. Again, you may want to see their website and all the websites of those that I speak about today, as these can be very helpful resources to see if you qualify. There are also resources through rideshare apps, and many medical centers themselves will offer temporary housing or housing discounts for patients traveling to their facility who require overnight or longer stays, right? There may be eligibility restrictions, but just check, talk to the center, talk to the team, and do some research ahead of time, and you'll be prepared. A lot of them actually have some philanthropy, or money put aside or funding to help patients who come in. So they're beautiful, generous donors that do this all the time. One example is the PAN Foundation. This is not to any one institution, but it offers a program to help eligible patients to get to their appointments. The American Cancer Society has had a similar program in the past, but during the pandemic, it got suspended. But there's plans to reinstate that when circumstances allow. So ask questions. You never know. Like I tell my kids all the time, nothing is impossible, but it is impossible if you don't ask.
That's true. Thank you for providing some of those tips on those great resources. We hear from patients that managing the cost of care is one of their top concerns when considering a specialist. So where can someone turn if they're worried about their ability to pay?
Yeah, that's a very good question. So the cost of care is obviously not limited to just travel, right? Unfortunately. So people may have questions regarding their benefits or medical coverage. They can look up your policy and explain what benefits you're entitled to so you understand what your costs that you may incur. Some medical centers and insurance companies have patient or nurse navigators who can walk you through the process step by step. They can help explain your benefits, connect you to the resources you need. Again, ask and seek and ask, and you can be told. So in addition to ThyCa, Light of Life, and the THANK Foundation, there are a number of national organizations that can help provide support or offer resources for helping patients understand insurance, which is very complicated, and also provide some guidance. So some other examples include AARP, healthcare.gov, the PAN Foundation, and Triage Cancer, amongst many others.
Those are such great resources, and I really encourage everybody to check them out. Another thing that we hear from people in the thyroid cancer community is that sometimes just the day-to-day aspects of life can present challenges to finding care. Can you expand on that a little bit and how to navigate them?
Yeah, I think this is very important for your care team to recognize and understand, right? I mean, you heard that I'm a mother, so just like all of you, we all have obligations, right? It's not just children, there's parents, there's many things, right? So we must recognize that everyone has obligations in life, and that if you work, taking time off from work, or if you have kids, finding a babysitter or providing care for a loved one can be a challenge. But it's very important that you remember that you have to prioritize your own health because no one else can do that for you. So please, 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 there's so many people out there that you don't even know that are willing to help you when needed, right? So just ask. And these are the kinds of topics that advocacy and support groups can really help you out with, right? Having that support is so important. Another barrier is language, right? Language barriers can be a major factor for patients whose first language is not English, right? Most of the material and physicians are speaking English. And so patients or providers may not have access to the translation service and know they're available. So some institutions will offer free of charge translation services. That's the ideal. But cancer care can provide a wide variety of resources and tips for patients whose primary language is Spanish. And there are several other resources. So, or take someone with you, right, that speaks English can help out.
That's awesome. Yes, definitely bring a friend if you've got somebody in your life that's bilingual like that. Doctor, you touched on visits. What's your perspective in terms of the role of telehealth for patients with thyroid cancer?
So I think, it's amazing how many places said we can't offer and we can't do telehealth. But the pandemic came and this definitely opened eyes, right? It accelerated the use of virtual office visits as people sought to limit their potential exposure to the virus and medical centers had needed to control their capacity. So even though telehealth existed before the pandemic, of course, but its utility is much more broadly accepted and used now. So it's particularly useful for people who have difficulty to access care. So those who live in rural settings, those who are elderly individuals, and folks with limited mobility. So people in the thyroid cancer community are also dealing with the pandemic, right? Just like everyone else. But they do have some additional precautions that need to be taken because they have cancer. So your doctor may recommend measures that are typical, right? Practice social distancing, wearing a mask, washing hands thoroughly and regularly, limiting exposure to crowds and indoor locations. But people who are immunocompromised need to be extra vigilant. The COVID vaccine is available to most people and is encouraged, so you definitely want to consult with your doctor to see if that's an option for you. At the same time, thyroid cancer can't wait for the pandemic to be over, right? So the bottom line is that if you need care, seek it out. Don't wait for things to be better or for the pandemic. Talk to your doctor because they're the best one to help you explain when is the best time and what to do. Whatever medical center that you go to, they should all be taking the necessary precautions to limit your exposure and keep you safe. So I don't want you to be afraid to go see them because of the pandemic. Just call them ahead of time. Ask them and learn what their protocols are, but please do not put off going to your appointments, as time is of the essence when dealing with cancer.
Absolutely. So speaking of going to your appointments, what are some, really practical guidelines to make the most of the time that you spend with your specialist?
Yeah, so great question. So being prepared helps a lot. So what does that mean? Well, it helps to be organized, right? So trying to think ahead of time, planning ahead. So it's a good idea to check with the physician or doctor's office that you're going to ask, what do I need to bring with me, right? I often tell patients to bring a list of their medications because it's 100% that they're going to ask you to write that out, right? Plan on bringing a picture ID, your health insurance card if you have one, and your referral if it's required by your insurance. I tell patients, bring a health history, including relevant medical reports. The referring physician's office can help you obtain some of this, right? Some of that includes like notes from the doctor, even the last summary, a pathology report from the fine needle aspirate biopsy, scan or imaging results, and then perhaps if you have an operative report or what's known as a surgical report with the related pathology report, that can be very helpful. And then as we talked about earlier, bring a list of medications because it's 100% you'll be asked to write that again and patients get tired of that. But this is very important and it should include prescription as well as over-the-counter medications as well as nutritional supplements, including the dose, the strength, and the frequency, right? And they can all have interactions and that's why it's important to bring all that with you. Never, ever hide. Patients are afraid to tell us about the supplements and over-the-counter because they think we'll take it away. We're not going to take it away. We just want to make sure that you're safe. I also highly recommend writing out a list of questions ahead of time, or, some of you like to type it on your phone or your iPad or type it on a piece of paper or write it out. You're likely to have a lot on your mind. Doctor speaks quickly. You'll be nervous. So it's helpful to have it written down, your questions and some points so you don't forget to ask about anything important, right? I also recommend bringing a pen and paper to take notes, or your pad or your phone, and just explain to the doctor, like, I'm using my phone not because I'm ignoring you, but I'm using it to take notes. So you need to write down the answer the doctor gives you or some instructions they may give you, and that way you won't forget what's discussed. If you don't understand anything, please, please, please don't be shy about asking for clarifications. It's very important that the details of the proposed treatment plan or care of your diagnosis can be very difficult to remember. Doctors use a lot of medical jargon, a lot of words that may be unfamiliar, but it's okay to ask your doctor, can you spell that out for me? Can you help me or write it down for me? And ask for an explanation of anything that's unfamiliar to you, right? Sometimes we forget that patients don't know those words. So it's okay for you to also have them repeat it back. So you can say, I want to make sure I understand you correctly. Did you say blah, 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 right? And repeat it or summarize it in your own words. You can also keep notes and records in a binder or in a file folder or on your laptop. And I would consider keeping a special bag to carry your notebook and notes. your blood work, other papers to all your appointments. Because remember, it's multidisciplinary care, which means you're going to see a group of specialists, right? Now, ideally, I recommend all my patients bring someone with them, right? Because it's often hard to hear things, not from being hard of hearing, but it's a lot to soak in. So having a second person there is a second set of ears who can also take notes, and this can be invaluable. Also, one thing during the pandemic that we did, when a second person couldn't come into MD Anderson for a while, we actually would ask every patient, would you like somebody to be on FaceTime with us so they can hear as well? And that worked really well. If you're having a telehealth appointment, all of these points above still apply. So if you need to send medical records, you can ask your doctor's office the best way to do this. The office that you're going to may have a secure server where you can send your private medical records. So you can do all these things ahead of time, right? And when you're doing a virtual visit, in addition, I would make sure you know how to sign in before the day of your appointment, set up your computer so you can hear and see clearly, and then just make sure that your room, right, is free of distractions as much as possible, right? You can keep it plugged in with a power supply, and close all unused windows and apps to help improve your connection, right? Things that you've been doing for the last year in the pandemic can all be helpful for your virtual telehealth appointments.
That's awesome. Thank you. So that really does bring us to the end of today's session.
So thank you so much for having me, Daria. And thank you to everyone who watched today's seminar or is watching in the future. I had such a fun time thinking through this. And again, I really believe in patients being their own healthcare advocates. So please don't hesitate to reach out to all these wonderful resources that exist out there.
Thank you. And thank you, everybody, for joining us in our latest #TruthAboutTC seminar. I hope that the information discussed today helps you find the right care for you. I'd like to thank AZI for making this event possible, as well as ThyCa, the Light of Light Foundation, and Thank for co-hosting the #TruthAboutTC seminar series. These pages, the ThyCa page, Light of Life page, the Thank Foundation page, these are wonderful resources for patient advocacy. Be sure to follow them and be part of such inspiring communities. And you can also find information about living with thyroid cancer at www.truthabouttc.com. Most of all, I'd like to thank everyone who tuned in from around the country and for being part of this conversation. If we were unable to answer your questions during the presentation, please speak with your healthcare provider and check out the resources available on ThyCa.org, checkyourneck.com, and thankfoundation.org. And lastly, and most importantly, thank you so much, Dr. Busaidy, for this wonderful presentation. And thanks to everybody else out there for joining. Thanks so much.